My educational background is quite straightforward. I graduated from high school, went to serve in the military, and after that I applied to the medical school of my hometown here in Oulu. I spent 7 years in medical school as I was an exchange student for a year. After graduating, I started working as a clinician, mostly in a health center, and decided that I'd like to see what the pathologist does in real world, in everyday work. After working for a short time in a pathology department, I decided that cancer is the most interesting disease and decided to pursue that career. When I started working as a specializing pathologist, I spent most of my time in Oulu, but I also worked for a little bit more than a year in Rovaniemi in Lapland Central Hospital. It took 5 years to specialize and to get the degree of a specialist in pathology. In the end of the education, there's a 2-part exam. And after completing those and serving the time, so to speak, I could apply for the degree. After I got my degree, my boss asked from me that would I like to specialize further into breast pathology, and I said yes. A typical workday for me is working mostly with a microscope on diagnosing samples, classifying diseases. We pathologists also do work on surgical specimens. We select samples from them and examine them. We gather samples for the biobank. When we receive a cancer sample that is not fixated, there's an option for us to take a fresh tissue sample to be collected to the biobank. We consult each other. I consult younger pathologists, but also I consult more experienced, more senior pathologists to find the correct answers to each sample. Every week we also have a tumor board on breast cancer, and during the week, almost every day, there's some samples that are reviewed in respect of the tumor board. We also look at samples from other laboratories and make analysis on them. Also, some of our pathologists take part in education of medical students. We have medical students visiting our department and seeing how we do the tissue sampling from the surgical resection samples. They also see how the frozen section samples are done and interpreted and reported. Also, many of our pathologists give lectures as well. A pathologist is in contact with several different professions, also other specialties, other doctors, but also entirely different professions, such as laboratory nurses. We have also a hospital biologist, a cell biologist in our department, and others as well. Every week there's a breast cancer tumor board, and there's a pathologist in that. There's also a radiologist, oncologist, and a surgeon. In the tumor board, we review usually 10 to 12 cases, cancer patients, and we see that the diagnostics are in line both with histological and cytological samples and radiological imaging. And then the question might be about the primary treatment or some other special situations. It's quite rewarding to work in tumor boards. It's the communication and the mutual respect to one another is something that I think everyone enjoys. It's also a place to learn. In addition to my own samples that I sign myself, I review a dozen samples for every meeting. So it accelerates my the diagnostic skills. Attending tumor board meetings is also a way to see how my work makes a difference and how it affects patients. We can see that how the treatment is steered to one side to another through our work. The World Health Organization's tumor books, the blue books, are in everyday use, and that is the most important part of literature that we hold on to, and it's the basics of tumor classification. In addition to that, we have national guidelines on breast cancer, and also, for example, on HER2 analytics, we follow the ASCO-CAP guidelines. So those are in everyday use when we analyze HER2 samples. And of course, there's robust science behind these guidelines, so that's what we follow. When it comes to individual treatments, it actually is here already. In the field of breast pathology, we have estrogen and progesterone receptors, proliferation markers, and HER2 analytics in our toolkit for several years already. Although we are not so included in the decision-making of surgical treatments, but we can see it every day, how the patient and the surgeon have decided on the surgical treatment, if it's a surgical treatment that removes only a part of the breast tissue, or a mastectomy that means that all of the breast tissue is removed. So we can see that every breast cancer surgical treatment is personalized. In many cases, patients receive oncological treatment that are in line with some stainings that we make, and in that way we can offer the correct treatment to every patient. Two most important parts of our future that will change things are molecular pathology and the digitization of pathology. So scanning slides will improve our workflow inside one lab, but also between laboratories. It would probably make consultation easier and more frequent in most cases. Molecular pathology, or more thorough study of biological properties of different types of cancer, is also a huge opportunity, but also probably a big challenge for us. The amount of information about cancer and the cancer types is greatly increasing, and we need to keep up. Also, digital pathology makes analyzing samples with computers possible. So in the future, we will see different kinds of applications and assistance from software as well. As we can see in many different applications outside medicine, we can see how artificial intelligence is benefiting us and opening some doors. In time, it's hard to say exactly when, but artificial intelligence will definitely assist pathologists in the future as well. To anyone who is thinking about coming to this field, I say welcome. I think the culture in this field is special, and the future is quite interesting to see how it unfolds.